Hello, good morning, everyone. Welcome to Suisselle's webinar. I'm going to host you today, Dr. Gabriel Siquier and Dr. Timur Taskesen, where I will do the introduction first. So first, let me introduce you to Dr. Gabriel Siquier. Dr. Siquier is a board member, certified aesthetic physician who is teaching worldwide how to use the latest protocols and techniques in aesthetic medicine. Dr. Siquier provides extensive hands-on injections trainings, sharing his knowledge in the field of safety, applications backgrounds, and science in international congresses about skin rejuvenation and anti-aging. He has been speaker for more than a decade, and for major pharmaceutical companies like Suisselle, he became key opinion leader, providing consultancy and presentations worldwide. Research of Dr. Gabriel Siquier is widely published across international scientific journals. Further, he is part of the research group NEOMA at University of Girona in Spain, where he's conducting clinical investigations and developing medical protocols for new products. Finally, he is the founder and medical director of Dermatoclinics International, with several locations in the Netherlands and Spain. So Dermatoclinic is an international medical institution that invests in research and education and is offering a wide range of the latest aesthetic treatments. So thank you for welcoming Dr. Gabriel Siquier. And secondly,
thank you very much. It's a pleasure to be here and an honor to collaborate with you. Thank you.
Pleasure shared, Gabriel. And secondly, allow me to introduce Dr. and PhD Timur Taskesen, who is a distinguished figure in the field of dermatology with a remarkable list of accomplishments. Dr. Timur Taskesen currently serves as a head doctor at Dermaesthetic Allowances in Zurich, Switzerland. His educational journey led him to some of the world's most prestigious universities and university hospitals. His extensive training in medicine and biology, complemented by specialized instruction in surgery and dermatology, provides the solid foundation for his comprehensive knowledge in these fields. What truly distinguishes Dr. Taskesen is his unwavering commitment to the field of dermatology and aesthetic medicine. He actively participates in national and international conferences, collaborates with various committees and associations, and regularly attends numerous aesthetic and medical congresses. His passion and dedication to advancing to the field of dermatology and aesthetic shine through his continuous involvement in this significant event. Please join us with a warm welcome to Dr. Timur Taskesen, who is a recognized expert in the domain of dermatology and aesthetic medicine as he participates in an upcoming events. Thank you. So
thank you very much.
Thank you. So just before we start the webinar, I want you to let you know that all the questions must be dropped in the Q&A and not the chat. And at the end, Dr. Siquier and Dr. Taskesen will try to reply to most of your questions. Thank you. Dr. Siquier.
Thank you very much. It was a nice introduction. For me, it's a pleasure to collaborate today with Dr. Taskesen in this webinar. And let's gonna talk a little bit about Suisselle. Suisselle is a Swiss pharmaceutical that was founded in 2010 and is located in Yverdon-les-Bains. It's close to Lausanne, and they have mastered 2 in-house production rooms with a CE mark portfolio of dermal fillers and injectable boosters. They are the inventors of the patented technology, the CHAC technology. They are driven by 3 main cores, that is innovation, excellence, and customer focus. when we are going to talk a little bit about the CHAC technology to understand why these products are different, and I think they are definitely better than others that we have into the market. CHAC technology is a way to stabilize the hyaluronic acid with active ingredients without the use of any cross-linking agent or a stabilizing agent. This stabilized complex will be an optimal vehicle for transporting the essential nutrients into the skin and to activate different cellular processes. We have two major steps in a solid phase. First, we are going to create a high molecular weight hyaluronic acid matrix, and then we are going to add vitamins, amino acids, oligoelements, and we are going to process that mechanically through a shear deformation that will integrate the vitamins, amino acids, and into the matrix, creating some bonds between the hyaluronic acid and the active ingredients. That will create a 3D matrix, and then we are gonna stabilize again, transforming this matrix into the liquid phase. So we're gonna have three advantages. We are gonna have the intrinsic structural and biological benefits of the matrix formation of the hyaluronic acid. Then we're going to have a supramolecular complex formed in the solid phase that will make a distribution specifically of amino acids, vitamins, and the nutrients into the complex. We're going to have an integration, both hydrophilic and hydrophobic, and we are not going to have any excess. Then we are going to have the liquid phase that is going to allow us to have a slow release but progressive release of the ingredients. That's very important because that allows us to put competitors into the formulation, like we are going to see today, copper and zinc into the formulation of hair. And thanks to this progressive release, they are not going to interfere in the receptor at the same time. So we're going to have a better activity, better cellular activity, thanks to that. Which one is the difference that we're going to find between the different cocktails that we have into the market? The other cocktails that we have with hyaluronic acid and other active ingredients, they are a mix. So they don't have the supramolecular complex, and they will disappear quickly into the tissue. Thanks to the CHAC technology, these interactions that we have between the complex and the hyaluronic acid will create a slow release, but also will stabilize the complex. So the hyaluronic acid matrix will protect the other ingredients, for example, vitamin C, that is very volatile, and it's going to stay for around 2 weeks into the tissue, making a unique activity because it's going to be the trigger for the cell to produce a specific ingredients like will be collagen, elastin, and in a sequential way. So we're going to have longer lasting results. We're going to have an homogeneous distribution into the tissue, and we are going to provide the skin with what it really needs, thanks to the formulation. Have specific formulations for every product. Sometimes we have this comparison, is Cell Booster a filler? No, it's not a filler. Hyaluronic acid fillers, they are cross-linked, and then with BDD or PEG, and they are meant to give volume. So we are gonna win mechanical activity with a filler, like the Apriline filler line from Suisselle. But what we are doing with Cell Booster is complement the activity of the cell. So we are talking about biocomplementation, thanks to this mechanically stabilized product. We have different products in range, shape for fat deposits and fat drainage, lift that is going to have activity on fibroblast hydration, microcirculation, glow that is specific for hypopigmentation, but also hydration, and hair that is going to work on the hair follicles and onto the scalp. So we are going to be able to trigger the cells to rejuvenate the skin from the inside. Other mesotherapy products that they are in the market, they are native HA, so that will be good for hydration, but will not have this complementation. Or we have some cocktails that, as we see, we need much more procedures to achieve the result because they're going to disappear faster. And then we have a cell booster. That is a new range in injectable booster. It's the only one stabilized mechanically without any cross-linking agent. And I'm repeating that a lot because it's very important for us to understand. Once we modify the hyaluronic acid molecule, it's going to become a little bit more stiff. So it's going to lose a little bit of the biological activity that it has. This doesn't happen with Suisselle because we didn't modify. We simply stabilized through mechanical process. So we have strong interactions between the amino acids, the peptides that we have into the formulation, but no alteration of the molecule. And that's very important. And then, as last one, the fillers, they are made like acrylamide fillers, they are made to give volume. We're going to have overlapping activities. We also can be able to give hydration because we are both made from hyaluronic acid, but the indication is going to be different. So filling wrinkles and give volume. The good thing of cell boosters is that you can combine them with fillers and with botulinum toxin or energy-based devices. We're going to see today also some combinations for hair. So summarizing this long explanation, no chemical binding agents, gradual and optimal release of the active ingredients, and unique complex ingredients that they are specific for the indication. So in that way, we're going to achieve the best results. This is the wonderful portfolio from Cell Booster, Lift, Glow, Shape, and Hair. And today we are going to talk about hair. Last thing that is, but very important, is that Cell Booster is a medical device class 3. What it means, class 3? It means two things: that is safe and that can be and is effective. So has been go through all the requirements to achieve that. But the most important thing is that this has able to be injected. Where we are going to have our best results with Cell Booster is when we inject this product. We can inject it and it's completely safe and effective and has been made with the patented CHAC technology. I think now it's time for Dr. Taskesen, and he's going to explain more about Cell Booster Hair.
Thank you for this perfect presentation so far, Dr. Siquier. So next slide, please. So this slide presents a summary of the advantages of and indications of Cell Booster Hair, a product that is very useful to promote hair growth, prevent hair loss, and also improve the quality and the state of the scalp. But before we dive in, I think it's just best, maybe next slide, please, to just go into the hair cycle. You know, hair loss is a prevalent issue in medicine, and it often carries significant emotional weight for our patients. So the hair cycle, as you can see on the slide, consists of three main phases: the anagen, the catagen, and the telogen phase. The anagen phase is the active growth phase, where the hair follicles are actively producing hair, and it lasts for several years and determines usually the length of the hair. The catagen phase is a transitional phase where the hair growth stops and the follicle shrinks. This phase lasts for a few weeks. And the telogen phase, also known as the resting phase, is where the hair is released and falls out. The phase lasts for a few months, and after this, the cycle restarts again. Hair loss, next slide, please, also known as alopecia, can occur to various factors including genetics, hormonal changes, medical conditions, medications, stress, or sometimes even the excessive use of hairstyling practices. Understanding the underlying cause of the hair loss is really crucial for us to determine the appropriate treatment approach. Next, please. So, what does this mean? So one more, please. So you can see these three things now on the slide: mitotic arrest, synchronization phenomena, and the shortening of the anagen duration. So let's break down each of these terms. So what does shortening of the anagen means? This means that the duration in which the hair follicle actively produces hair is reduced, and as a result, the hair becomes shorter, it enters the next phase earlier, and this leads to thinner and shorter hair growth. Mitotic arrest means that the cells which are responsible for the new hair temporarily stop dividing. So this can occur to hormonal changes, meaning usually also nutritional deficiencies or certain medication. And the synchronization of the hair follicles refers to the phenomenon where multiple hair follicles enter the same phase of the hair cycle simultaneously. So this can happen usually under hormonal changes. And by this, it's a noticeable change in hair density and shedding across the scalp. Next slide, please. So understanding this pathological dynamics of hair growth is really essential for the accurate and appropriate management. So there are different kinds of treatment approaches, including medications, topical treatments, hormonal therapy, or even surgical interventions. So here on this slide, you can see, for example, the nutrients which are really relevant to hair, and also it's important to know what the patient is missing. So each individual and may need different kind of nutrients. So it's really important to know what is important for the healthy hair growth. Here on this slide, you can see that mainly B vitamins, antioxidants, and trace metals are really important for our hair growth. And this is then definitely also depending on factors as age, sex, health status, and dietary habits. Next slide, please. So restoring these nutrients to the scalp may indeed help to fight hair loss and stimulate hair growth by addressing some of the underlying factors involved in hair aging. So here on this slide, you can see how we can nourish our hair follicles by providing essential nutrients to the scalp, by supporting the cellular function, like with antioxidants, improving the scalp health with anti-inflammatory properties, and enhancing the blood circulation. Next slide, please. So if a product that contains these nutrients, which are really key for the hair growth, it would be really beneficial for us. So next slide, please. So in comes the Cell Booster Hair. The Cell Booster Hair is a customized formula by Suisselle, as Dr. Siquier nicely put together. The high molecular weight HA with this patented CHAC technology encloses the vitamins, mainly the B group, amino acids and oligoelements, and also rutin as a flavonoid. It has a really positive effect on scalp dermis. Next slide, please. So this slide gives you more details on the benefits of the oligoelements and certain vitamins of the hair follicle, of the hair formula. Next slide. So this specific composition gives a positive influence on different and various aspects of hair health. So it enhances the hair growth, it addresses the issue of hair loss and graying, and strengthens the hair follicles. Moreover, the product also supports the metabolic processes related to hair follicle function and also contributing to overall hair health. Next, please. So this is something that Dr. Siquier also talked about earlier. So the nice formulation and the speciality of the CHAC technology allows us to put something inside which are usually competitors for the same receptor. So like, for example, zinc and copper. And by the sequential release of these oligoelements, we can trigger different kind of reactions through the same receptor without interfering each other. Also, the regulation of the activity by using zinc and biotin, by antioxidant usage of niacin, and also pantothenic acid is something that helps to promote proper hair growth and also is improving their hair hydration. Next slide, please. There are nice studies also which are in the European guidelines of the hair medication options and written by experts all over Europe, and it shows that the hyaluronic acid itself has also a nice effect on the hair growth and also on the dermal papilla. The amino acids are reinforcing the hair fiber, and by this also restructuring and giving the hair its vitality back. Next slide, please. So Suisselle, it's something really important in this case because it did a special clinical trial, and this has been performed by the Gredeco group. And this study, which is shown here, this trial provides us insights into the efficacy and safety of cell booster hair in promoting hair health and hair growth. This slide includes details as such: the study design, the participant demographics, the treatment regimen, and also the outcomes measured, such as improvements in hair density, thickness, and overall hair health, and also providing us with any adverse reactions observed during the trial period, which has been none. Additionally, it also provides analysis to assess the significance of the results. So this type of research, which is really important for us doctors and practitioners, is that it contributes valuable information to the fields of dermatology, aesthetic medicine, and cosmetic science by evaluating the effectiveness of the products and technologies in improving hair conditions. So this helps not only us, but it also helps to inform the consumers about the safety of innovative hair care. Next slide, please. So this slide goes more into detail about the study design and about what exclusion criteria has been shown in the study itself. And also, like as I said before, the participant demographics, the treatment regimen, and also the measurements. Next slide, please. So these are the findings of the study. And you can see here an optimized way to show, and also to show that the thickness of the hair after the injections of a 6 treatment protocol with a cycle in between 2 weeks is just showing a continuous and improvement of the hair strength of the participants that has been injected. Next slide, please. Also, the shininess of the hair, and the hair got more beautiful and more coarse, that the people just were also evaluating it themselves, and also the injectors. Next slide, please. And this is why we're using this product. Surely, the loss of the hair reduced by 54.9% after a cycle of 6 treatments. Next slide, please. The density got better. Sure, this is also something really, really important, because the density of the hair in all assessed areas, So this is a really, really significant benefit for our patients, and it gets even better after a full protocol of 6 injections. Next slide, please. So these are pictures from the trial. Really impressive. Next slide, please. So the picture you saw before is just also a nice confirmation of the improvement of the hair thickness, which has been measured by the ProScope X30. So something like a biometric confirmation of the hair thickness, which is really, really a standout for the product, and also a standout for Suisselle involving in these kind of innovative research. Next slide, please. So again, measurements of the hair shine by glossimeter, also a nice confirmation about the improvement, not only just like by measurements of the patient himself, but also by using a biometric confirmation. Next slide, please. So overall, you can see that the patients already noticed a nice global improvement of the hair condition by, you can see, by 96%. And also the high satisfaction is not also on the side of the patients, but also on the side of the injectors, as you can see that it's really helping the patients. And most of the patients, as you can see here, it's really nice improvement of the hair appearance. And so this is a really, really nice. So next slide, please. So again, here, significant improvements of the patient's hair. These are nice pictures from the study. Next slide. Again, really nice. You can also, even on the photo, you can see like the improvement and the coarseness of the hair, and also the shininess of the hair improving. Next slide. Here, also on the vertex, you see nice density that is coming back after the 3rd injection already. Next slide, please. And also here, vertex and also frontal areas which have been treated, and visible results already after the 3rd injection. So after 6 weeks, you can see these nice results. Next slide, please. Also here, really nice. Next slide, please. Here again, like a huge benefit after the 6th injection. So after a full course treatment of 12 weeks, it's significant improvement of the hair, and also just like the hair density coming back to this young patient. Next slide, please. And even when you think there's not much to reactivate, you can see it's a huge and significant improvement when you just do. Next slide, please. And even with female pattern hair loss, which is really, really difficult to treat, and sometimes also by combination of different kind of medications, but with cell booster hair, you can promote nice and healthy hair growth again. Next slide, please. And here you can also translate even through the pictures that you can see that the hair is more shiny, that it's more coarse, that it's more dense. And this is really a nice and huge benefit. Next slide, please. Same here. You see how vital the hair seems to be even through the picture. Next slide, please. Same here. Next slide, please. So overall, in conclusion, you can see that Cell Booster Hair is really a nice product which offers not only high patient satisfaction, but also it's really nice to see that it's working. And even by biometric assessments, we can prove how the product is working for our patients. And it's really nice that we have something on our hands which we can offer our patients, and which has also been included now in the European guidelines as an additional therapy option, as an injected therapy option. Next slide, please. And for me as a dermatologist, it's also nice to say that it's tolerable, so you don't have any kind of adverse reactions other than the injections, which might be a little bit painful, but usually it's definitely tolerable.
Yeah, wonderful results from the study, Dr. Taskesen, and we can see that it's improving all the parameters that have been measured: density, shine, reduction of hair loss, with a very positive feedback from the patients and from the injectors. Let's want to see now which one will be the protocol to apply cell booster hair. And we have 4 different areas, and we can use also different techniques. We can use micropapilla on the whole scalp. It's important that we understand that the areas that they are without hair, except the alopecia areata, we cannot recover them because the hair follicle has disappeared. So we are going to always apply the product on the area with hair, and generally it's going to be on the frontal line and on the vertex area. Let's going to see how we are going to proceed with injections. You can use a longer needle or a shorter needle. Both of them are good. You need to use the needle that is easier for you, but what is important is the plane of injection. We need to target the fibroblast, so we need to inject intradermally the product. It's possible to combine cell booster hair with lidocaine or adrenalinated lidocaine. If you wanted to make it more comfortable for the patient, you could make a progressive frontal nerve block. Or not. That, I think, depends on the culture and the type of patient, but you can mix it without any problem. You're not gonna alterate the formulation. I think it will be more comfortable for a patient anyway. On the vertex area, remember that we have innervation also from the occipital, so it's better to make a concentric cycle to have more comfort for our patients. You can cover the whole area. Occipital area, generally, we're not going to have problems because the target and the type of receptors that we have on the hairs in this area will not generate alopecia. But here you can see how I'm injecting superficial the product, and sometimes we see a little bit white. This white is because I put a little bit of adrenaline into the formulation, so with less quantity of anesthetic, I can achieve better result, and then I'm also going to have a little bit less bleeding. Some patients that they are taking some anticoagulants, it could be that this happened. Let's gonna see the hair area, alopecia areata barbae. Also, sometimes socially affects a lot the patient. We are going to select the area for injection, and we are going to apply also intradermally the product. Remember that the hair cycle in the beard is different than on the scalp, and is also different than in the brows. So on the beard, we're going to have faster results. In the brow, it's going to be much more slower, and in the scalp, we have something in between. You can see that the procedure is very easy. You could also put some topical anesthetic on the area to make it more comfortable for the patient. And I think, Dr. Taskesen, you can comment these wonderful results of your patient.
Yes, so what's really important is that also Dr. Siquier, thank you very much, also stressed on it, so that you have to inject it where you still have hair follicles, because if you have a scarring kind of alopecia, it won't help. So this is really important. But for example, here with my patient with alopecia areata barbae, he suffered of that a lot. And as Dr. Siquier also said, sometimes it's something socially that is just like having such an impact also on male patients now with a beard being en vogue. And so even if you have small patches without hair, and you can see here what we achieved, or what I achieved after only 3 sessions of Cell Booster Hair, and you can see even that the hair that is coming out was initially depigmented and is repigmenting, and this is something that is really, really nice with the product.
Yeah, the ability, because the hair follicle on areata will not have yet the power to pigment, but we are giving all the active ingredients to help him to pigment. And you can see here the fact at the beginning you see little white hair, and then finally is repigmented. This is a case of mine that I treated the whole beard area, and you can see how improve the density, the color, and all the patches they disappear, because this was a very difficult case. Here we have the frontal. You can see some hairs still white, but it's completely pigmented and very much higher density. And this is another case that he didn't got any hair, and we could recover this gap from areata barbae. I think is very, very interesting. And thanks to that results, we brought together a very nice poster that was on INCAS, that was accepted by the scientific committee. And I don't know if you want to say something about this achievement, Taskesen.
So I'm really happy, Dr. Siquier, to be working with you, and also of the support of Suisselle. So this was really a nice possibility for both of us to present our nice results, and also to show how the product is having a positive effect with the special CHAC technology, but also this combination of the micronutrients, vitamins, and also the amino acids.
Because you give the hair follicle what it really needs, and it's safe, it's effective, and it's much faster. This is a scientific publication. You can ask if you want to read it, because Suisselle can provide it to you. And another case of areata barbae in this, but another case of areata, I'm sorry, but in this case in the scalp. Can you comment on something, because I think it's very good result.
Yes, so this is a patient of mine who came in suffering of alopecia areata on the scalp, and you can see by the coarse hair and also by the skin color that he suffered a lot of these kind of patches, bald patches on the scalp. First, I did the medical background, also the lab tests, because you can never be sure if patches of like these appear on the head. So you have to rule out any kind of autoimmune deficiency, but also always think about syphilis in these kind of cases. All of these things were ruled out. And then I started an injection. He came to me after being injected multiple times with triamcinolone, so with steroid injections, without having no real effect. So next slide, please. And so I started then with the injection of Cell Booster Hair, and as you can see, it's gradually growing back, and this is really a nice option for my patient, because he suffered a lot of that. And this is really also something nice, because you can see that the hair is also getting shiny, and from this grayish color, it's getting also repigmented. And as Dr. Siquier already said, we're providing the hair follicle with what it needs, and now it can just provide the hair growth back again. This is also something. Oh,
Okay, you.
this is also something really, really hard to treat. So usually patients, female patients coming in and having such a problem after giving birth. And you can see that the hair, the scalp was showing with this female patient, and it took a little bit longer time, but you can see the density of the hair coming back, the shininess of the hair coming back, and this is a really, really nice result. Also, just like providing the hair in a way and in supporting the kind of cellular function with the antioxidants and with the vitamins, and also improving the scalp health.
Yeah, and I think sometimes these hormonal changes that influence that, but also we have a lot of patients after chemotherapy or radiotherapy that we can definitely reverse this effluvium in a natural way, in an effective way.
Yes, definitely, definitely. Also here, you can see it, you know, the density of the hair coming back. And also you can see the kind of repigmentation, which is really, really obvious and speaks throughout the pictures itself. Here, a case of alopecia androgenetica with a female patient.
Yeah, this is
Next
the case
slide.
of mine, and also in female, you can see this improvement of the texture of the hair, much thicker and much more pigmented. That's a thing that really surprised to the patient, because they thought that is not possible. And here I have a case that also is going to. I saw a lot of patients that they have this seborrheic dermatitis. They are difficult to treat, and thanks to the zinc that we have in the composition of cell booster hair, we are able to reverse it, and we can see very nice improvement of the scalp, but also of the hair. Again, a better pigmentation on that area. And I also presented at the INCAS, the 23rd Congress. And if you want to read more about this case, feel free to ask for the poster. Now let's now see some combination, and I think Dr. Taskesen is one of the best doctors with laser, so he can explain better this case.
So what we did here on this is just like combining this genetic alopecia with a female patient and combining the low-level laser therapy with the cell booster hair. So why did I choose this kind of approach with her? Because first, the low-level laser uses specific wavelength of light. So to penetrate the scalp and stimulate the hair follicles in a different kind of way. And this increases the cellular activity and promotes hair growth. And then by injecting the cell booster hair right after is just like something that is also good for the improved blood circulation. So increased blood flow to the scalp means delivering essential nutrients, which is also inside of cell booster hair, and also then the oxygen to the hair follicles. And by this, the improved circulation enhances the health of the follicles and supports the growth of thicker and healthier hair. And it reduces also the inflammation. So these are, for example, the specifications with the laser I used here. And this is the Photona Smooth laser, for example. So this is something where we use the hair restart program for those who also maybe have to happen this kind of laser in their practices.
Okay, so we have a protocol that we're going to have additional benefits. And what this graphic is showing you is the cumulative effects that you have with that product. Because when we are using a filler, when the filler is gone, the volume is gone. But when we are using cell booster, we regenerate the tissue. We have much better, happier hair follicles in that case, and then we can do little maintenance once a month or once every 2 months, just to keep the result on the green area, on the happy area for the hair. And we can combine it, of course, with other treatments, as we saw today with the laser. It's always important to do first the energy-based device. We can wait 15-20 minutes to give the skin, in case was a little bit heated, to calm down, and then we can apply immediately the cell booster on the same day. The acute phase, we're going to do 3 sessions bi-weekly, and then the maintenance phase once a month or every 2 months, depending on the needs and the characteristics of the alopecia that we are treating. We have other publications like this one I did on Prime. And this one is with Cell Booster Glow that I did on polymers. We can see the effect. I'm making a point on that because we have scientific publications that have been that went through scientific committee, and we can demonstrate, as we saw on the study of the hair that Dr. Taskesen presented, that you can have photographic evidence and clinical effectiveness, but also with scientific biometric parameters, you can check that this product is effective. Soon will be published this study that was conducted by Gredeco, and other areas that you can improve. For example, other publications that we have, this one is also again with Dr. Taskesen, is improvement of striae with cell booster lift. What you can say about this publication?
No, this is even just like also the previous article on Cell Booster Glow is really something excellent, and also with the article we did together for last year's IMCAS, this is really, really nice because it shows not only on the pictures that we can just activate the fibroblasts in a really hard to treat case of striae, and it's really, really nice. And if you should want to read this article, which would be both really happy, you can ask Suisselle for the article and see what Dr. Siquier and we did.
Okay, so I think it was very intense, and we are arriving pretty on time to the questions and answer time. So let's go and see in the chat. The first one we have from Hani Sayed. Say, the results are impressive for the 6 injection use. Could you tell us how to maintain the results? So, as I said before, maintenance depending on the cost, I will do it once a month. But if you are talking about alopecia androgenetica, I will target spring and autumn. That is when you generally you have the effluvium. I don't know if you think the same.
Yes, yes. So in the end, as humans, we are also having problems with this kind of seasonal shedding, and this is really, really important to have this kind of support in these kind of times.
And then Satu Lindfors is saying, how long lasting are these results? How often patients need to do the full interval, or do you recommend touch-ups after the full interval? Support treatment once a month is a bit inconvenient to our patients. How do you explain or sell it to your patients? Thank you. So it depends on the cause. For example, if you are after pregnancy, you have this effluvium, then you can recover the hair and you're not going to have this hormonal imbalance again. Or if you are taking a medication that is making you lose the hair. So I think, but alopecia androgenetica is chronic. And I think you need to settle at least once a month or once every 2 months and leave it more close interval during spring and summer. What do you think? Spring and autumn, sorry, I said summer. What do you think, Dr. Taskesen?
No,
Which one is your, how do you sell it to your clients?
I support you in that totally, because you have to think of this as a chronic disease. And so if it's just like the seasonal shedding, then you might be able just to reduce that and maybe just give an additional injection maybe every 3 months or maybe every 6 months, depending on that. I have some patients who come in just like for a preventive treatment, so coming in twice a year after a full cycle of 3 months. But if you suffer of the shortening of the anagen phase and you stop giving this kind of support, the hair goes back into this kind of synchronization, and also back maybe into this kind of mitotic arrest, which I showed you before in the slides. So you have to maybe talk to the patient and tell them that we cannot reverse it totally, but that we can stop it during this kind of treatment option, and rather taking vitamins all day for a long period of time, which might be also maybe not convenient. It's maybe better to tell the patient, come in every so often for an injection, and it's easier because we deliver what the hair needs in one session.
Yeah, I have an interesting question from the Metaskin. Say, are you injecting weekly? And I was saying no, because this product is stabilized, so we inject bi-weekly. So every 2 weeks, that make it more comfortable for the patient. And then, are you advising any topical product during the treatment? I have very good results, but maybe Dr. Taskesen can recommend us a good shampoo or oral supplement to help with the treatment. Do you think can improve the result?
Well, depending a little bit on the problem, because if you suffer of androgenetic alopecia, it's always beneficial to use the minoxidil still, and then do the injections just to help the hair follicle to recover faster and stay longer in the anogenic phase, which is also is done by the minoxidil. But for example, as shampoo, it's really good, so they maybe give something to reduce this inflammation on the scalp. And also you saw it on the picture which Dr. Siquier provided. The seborrheic dermatitis is also some co-condition that mainly comes also together with the hair loss. And by treating this, by using maybe a shampoo for reduction of dandruff, or maybe for chronic inflammation of the scalp, it really helps a lot. So you don't need any kind of corticosteroids. I don't combine that, but minoxidil and maybe a soft shampoo, this is something which I usually provide my patients with.
Yes, and somebody's asking, they are very interested here, I see, about the scientific publications. Please ask your distributor and they can provide it to you. And I have another question that they say, do you apply mesotherapy during breastfeeding? Well, in my case, I don't recommend to the patients. I don't know if you have another point of view, Dr. Taskesen.
No, Dr. Siquier, I support that as well, because during breastfeeding, no, even because you saw the pictures of the telogen effluvium after postpartum, after giving birth, and you need to wait and tell the patient that it's even though it's not harmful, I wouldn't inject during breastfeeding time. No.
Yeah, I have a point of Dorothea Turu saying the scientific posts are mainly case reports. How long have you seen using the product, and what percentage you see similar improvements stated in the product? Yes, the scientific posters are case reports, because this was not the indication from the product, like for example for a striae. So we want to bring something medical like the seborrheic dermatitis, but the publications I made with Suisselle, they are on Q1 on polymers, and is the highest level of quality that you can have. We have some divulgation articles in Prime, and we have the results of the scientific study that we generate to Gredeco that will be published soon. But these are not case reports. These are complete sequential experiments with very positive results in all the parameters that we measured. So I invite you to read the whole bibliography that we have there prepared. So I don't know if we have any more questions. I see a lot of thanks. Yes, say, what is the role of cell booster hair to treating seborrheic dermatitis? Dr. Taskesen, maybe you can help us with that. The role of cell booster hair with the seborrheic dermatitis.
So seborrheic dermatitis is just usually like a constant inflammation of the scalp, similar also to scalp psoriasis. So depending a little bit, just like also on the kind of bioflora or microflora you have on your scalp. It's just like this constant inflammation needs to be stopped, and by improving this kind of scalp health with anti-inflammatory properties, we can reduce the itching, the irritation, which are usually common issues associated by this. And in the end, this constant inflammation leads then into hair loss. And by reducing this constant inflammation by using the cell booster here, other than just the hair loss itself, it's something that is really helping to reduce and improve the scalp health, and also enhance the blood circulation, and by this promoting then hair growth and overall skin health.
Then somebody asking me, can we combine it with PRP? Or yeah, definitely you can combine it, but I think Cell Booster has already enough power that is not needed, the combination. I don't know, what do you think about that?
Yeah, it's just like I get that's questioned a lot. So you can combine it, but I wouldn't combine it in one session. So if the patient is really asking for the plasma, for the PRP treatment, sure, but then I would do it just like sequentially. So 1 week or for one time the cell booster, and then 2 weeks after the PRP. But as you said yourself, Dr. Siquier, the cell booster itself has such nice properties, so you don't honestly need the PRP. And from the evidence level, PRP and plasma is something that usually is really discussed a lot on these all of dermatological and aesthetical conferences.
Okay, so I think we need to sum up now. I will recommend you to follow us on the Instagram of Suisselle, that is Suisselle Pro. Instagram of my clinic is Dermatologist International, and Dr. Taskesen, which one is yours?
So either you can follow me on Taskesen.derma, or on the this is my personal account, or on the clinics that would be just derma aesthetic _ZH. Thank you.
Thank you very much. This webinar has been recorded, so if you want to see it again or you want to have more information, please feel free to contact with your distributor, and we will be very happy to help. Have a nice day. It has been a pleasure for me. Thank you, Dr. Taskesen, for your positive inputs, and hope to see you soon around the globe.
Thank you, Dr. Siquier. It was a pleasure. Thank you to all of the questions. Thank you very much.
Thank you.
Thank you very much.